Do you know that diabetic ketoacidosis may be the first sign that you have diabetes? It is usually the first sign of 20% of type 1 diabetes cases. The sign and symptoms of diabetic ketoacidosis can develop quickly. That is why it can be a life-threatening condition within a few hours. The early symptoms include typical presentation of a diabetic patient. For example, polyuria or frequent urination. Due to increased level of glucose in the blood, more glucose is excreted in the urine. This excretion is accompanied with the excretion of water and ions, so that's why there is more frequent urination. Polydipsia or increased thirst. Because urination increases, water need of the body also increases. Hence the patient is more thirsty. Not only that, the patient experiences dry mouth, so the body counteracts that by increasing the thirst. Polyphagia or increased appetite. Even though there is more glucose in the blood, it is still not getting broken down to form ATPs. So the energy need of the body is increasing and hence the need to replenish that increases. And patient gets hungry often. These are called the 3 P's of the diabetic ketoacidosis, and this makes it quite easy to remember. Remember, polyuria, polydipsia, and polyphagia. The other symptoms include blurred vision and confusion. Confusion and irritability are important signs to watch out for because the patient appears to be drunk and may become a risk to themselves physically. If you recall the case study we discussed in the beginning, the patient was also suffering from this. Not only that, there is the flush, dry skin due to dehydration, abdominal pain, feeling sick to your stomach or throwing up, fruity smelling breath. Fruity breath is another important sign of diabetic ketoacidosis because it is caused by the body breaking down the ketones. Weakness or fatigue. The patient have difficulty in breathing, so they start to breathe heavily. The heavy breathing in this case is known as Kussmaul breathing. It is named after Adolf Kussmaul, a German physician who first observed this type of breathing in the patient with severe diabetes in 1874.